We're ready, so we'll call the meeting to order, and I'll ask the sheriff to lead us in the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So good morning and welcome to our morning version of the prison board meeting. I'm a little disappointed. I was hoping there might be some donuts or something here, but I guess we'll have to. It ain't in the budget this year, so that's what we'll do. So the meeting minutes from our prior meeting in November have been circulated in advance of the meeting. I trust everybody's had an opportunity to review them. And if so, I'll entertain a motion to waive the reading and approve the minutes from the November 2024 meeting.
So moved.
I have a motion and I have a second. On the question, all in favor?
Aye.
Any opposed? The ayes have it. The minutes are approved. Anybody from the public wish to address the board on agenda items only? Please feel free to step forward. I see no one stepping forward, so we'll move on to the agenda. Our first item on the agenda is a motion to approve all current payables for the prison and the Community Corrections Center. As with our meeting minutes and other items, they've been circulated in advance of the meeting. I trust everybody's had an opportunity to review them, and if so, I'll entertain a motion to approve the current payables.
Motion. Second.
We have a motion and we have a second. On the question, all in favor?
Aye.
Any opposed? The ayes have it. Current payables are approved. Next, we'll go to our reports, and we'll go to the Controller's report. Mr. DiBileo, you have the floor.
Thank you, Judge. I just have to locate them real quickly. Reggie, do you have a copy? You can hang on to this one. Thanks, Reggie. Thank you. Thank you. Thanks, Judge. Sorry about that.
Nothing bad about you on those notes, so you can.
Not that I could see. Thanks. The Controller's report of the prison inmate and canteen accounts for November 2024. The Controller's office reviewed the prison inmate and canteen account reconciliations, which were prepared by the prison business office for the month of October 2024, and found no discrepancies between the reconciliations and the bank statement. The balance in the inmate account was $384,767.04 as of November 30th. The balance in the canteen checking account, was $484,651.09 as of November 30th, 2024. In addition, as of November 30th, 2024, the canteen account also included a balance in the Pennsylvania Local Government Investment Trust investment accounts of $923,320.96, which is earning approximately $4,000 monthly, and which will mature in January of 2025. And by the way, I have the current rates as of today. We don't know what they'll be next month, but we can talk about renewing those investments. During the month of November 2024, $82,031.56 was paid from the canteen account for the benefit, welfare, and education of county inmates. And a copy of those accounts are attached to my report. And that concludes my report.
Any questions for the Controller on his report? You indicated the one aspect is going to come up for renewal in January, but that'll be after our January meeting, right?
Yes. Yes, Judge. The first 180-day period will mature January 9th, and that's earning 5.32% annualized rate, $817,000 worth. Now, the rates have come down a little bit. The current $180,000 rate is 4.43% as of today, down from the 5.32 we're currently earning.
So that matures on January 9?
January 9th.
So if we're going to do anything with that, we have to do that now, right? Because the other one, there are two,
Yeah,
correct?
the second one is January 23rd, and that's $108,224 invested there at a current rate of 5.28, but that's after our next meeting.
Right, so we can address that one at our next meeting, but if we're going to do anything with the first one that we talked about, we need to do it now.
Right.
Okay. So I'll open up the floor. I know we don't have a crystal ball to see what the rate of return is going to be, but the terms will be essentially the same, 180 days?
Yes, it can be.
Okay. And the rate today?
4.43%
Okay.
compared to the 5.23 we're earning currently.
Does that lock in today if we vote today?
No, it won't until this one expires.
expiration.
January
Okay.
9th.
Okay. All right. Anybody have any thoughts? Seems to me like we should roll it over.
We can do that. And we'll make that happen right after the 9th. We'll renew it for another 180 days at whatever the going rate would be at that point in
At that
time.
time.
Shouldn't be too very different from what it is currently.
Okay, well, there's a Fed Central Committee meeting today, actually, so at least the expectation is that they're going to lower the rate, another rate cut, maybe a quarter point, but that'll have some sort of impact on it, I would imagine, don't you?
Yeah, I would imagine it would.
All right. So, all right, so the motion would be to
renew our,
renew it?
to renew it for another 180 days.
Okay, as of
As of
January
January
9th,
9th.
at the rate in
Whatever
force.
the going rate would be at that point in time.
So that's the motion before the board. Do I have a second? Got a second on the question? All in favor?
Aye.
Any opposed? The ayes have it, so that'll be renewed. Anything else? Any other questions for the controller? Then I'll entertain a motion to approve his report.
Motion.
Do I have a second?
Second.
On the question? All in favor?
Aye.
Aye.
Any opposed? The ayes have it. Thank you.
Thank you.
Appreciate it. Okay. I should also note for our record that our solicitor isn't here because we changed our meeting to the morning. He has a court appointment. And, you know, sometimes how judges don't like to alter court appointments. Some judges are like that, so he had to go, not in front of me, obviously, but he's from another judge. So, but he's read in to everything that we're doing here today. So, all right, next, Mr. McConaughey, the Community Corrections Center report, please.
Good morning, everyone. This is the house arrest report for the month of November. Adult house arrest had 161 participants. Juvenile had 28. Programs revenues, house arrest had $46,578.29. Juvenile had $5,060 for a total of $51,638.29. Year-to-date totals for both departments is $644,420.48. Programs expenses was $71,195.74. Program completions were 30. Violations were 9. We have 4 outstanding warrants for house arrest still. Overall report, overtime is at 72%, expenses at 91%, and revenues at 95%. And that's the end of my report.
Any questions for Mr. McConaughey? If not, I'll entertain a motion to approve his report.
Motion.
Do I have a second?
Second.
On the question? All in favor?
Aye.
Any opposed? The ayes have it. Your report is approved. Thank you, Mr. McConaughey.
Thank you. Have a good holiday, everybody.
Happy Christmas to you. Next up is the warden's report.
Good morning, Board. I almost said good afternoon, but good morning. The average daily population for November was 690 inmates. 560 were county inmates. We averaged 603 adult males, 4 juvenile males, and 82 adult females. The average daily population of U.S. Marshal detainees was 130. Our overtime and out-of-county boarding reports are attached. Our staffing update, we currently have 170 full-time officers on shift, 5 out on workers' comp, 1 on continuous FMLA, 96 with intermittent FMLA, 1 on administrative leave, and we have 5 full-time vacancies for a total of 182 full-time officers. As of November 30th, the revenue was at 68%, expenses were at 90%. Extraordinary occurrence reports, there were 6 in the month of I wrote January. I don't know why I wrote January. It's November, in the month of November. November 4th, a newly committed male was acting out in an aggressive manner, non-compliant as well, regarding the booking process. Staff attempts to de-escalate the situation were met with negative consequences, and his behaviors worsened. A decision was made to place him in the emergency restraint chair for the safety of all involved. On 11/12, an individual was observed to be acting in an erratic and unpredictable manner. Responding staff, along with the medical provider, decided that he would need to be placed on a suicide prevention watch. However, he was resistant to efforts to move into a camera cell, and he began to physically resist. A decision then was made to place him in the emergency restraint chair for everyone's safety. On 11/14, an individual was refusing orders to return to her cell, and this was causing an issue with the overall operation in the female housing unit. Staff had to use OC spray to gain her compliance. On 11/15, a newly admitted male was not cooperating with the booking process and began threatening staff. A decision was made to place him in the emergency restraint chair for the safety of everyone involved. 5th, on 11/18, an individual began displaying definitive signs of a mental health issue, so staff placed him on a behavior watch. However, this person then began to violently bang his head off his cell door, and a decision was made to place him in the emergency restraint chair for his safety. And finally, on 11/20, an individual was scheduled for transfer to Norristown State Hospital for treatment. This person was refusing to come out of his cell, and staff had to place him in the emergency restraint chair to remove him from the cell and place him into the vehicle for his transport. For those that don't know, the Norristown State Hospital is one of 2 state facilities that treat inmates with significant mental health issues. PREA, there were no PREA investigations completed in the month of November. Medical health care provider, I know this is on the agenda but as a member of the review committee, I wanted to let the board know that there was an RFP that was put out. We reviewed them, and that we are recommending Armor Correctional Health Services to the prison board. Armor Correctional Health Services is a physician-owned company that provides comprehensive medical, dental, and mental health services for incarcerated persons, and its management team has over 149 years of collective experience providing correctional health care. Commissary service provider, the current contract between Lackawanna County and Oasis Management expires on February 4th. I'm going to be working with Joe Weschler, the Director of Purchasing, to develop an RFP and put it out for vendors. And it's a tight timeline, And I don't know if we're going to be able to hit it at that for February 4th. Just wanted to give the board heads up on that one. And this concludes my report, and happy holidays to all.
Thank you, Tim. Any questions for the warden? Tim, we also talked about the preparation of an RFP for the work to be done by outreach with the GED program. Can you go into that a little bit?
Sure. I reached back in time to, I believe it was 2017 or 2018, the last time we did that, and I grabbed the RFP from that point in time. I literally, yesterday, I forwarded that to Joe Weschler. He's going to take a look at it and tune it up a bit, and then I'm sure get back to me with it, and we'll get it out as soon as we can.
Yeah, I think it's the opinion of everybody on the board that because of the amount of money that we're talking about expending, it needs to be handled, through proper normal channels, and that involves an RFP going out.
Right.
So, okay. Any other questions? All right. I'll entertain a motion to approve the warden's report. So moved. Do I have a second?
Second.
On the question? All in favor?
Aye.
Any opposed? The ayes have it. Thank you, Warden. You may have mentioned January, just like a little bit of a Freudian slip maybe there, because you're...
Maybe.
All right, okay. So it's my understanding now we're going to have a presentation by Mr. Rex Caldwell.
Good morning. My name is Rex Caldwell. I'm the Director of Business Development for Armor Health. I'm based in Westchester, Pennsylvania, a couple hours down the road. I'm here to do a brief presentation on Armor Health, and this is really very close to the presentation that we made earlier in the year when the RFP, going through the RFP process. I'm very familiar with Lackawanna County Prison. I did work for WellPath back in, I started back with them in 2019 and helped actually bring them back on board back in, I guess it was late 2020, and then we started January 15th, 2021. So 4 years, I guess I've known Warden Betti and some of the admin staff, excuse me, at the prison, and I'll be happy to answer any questions later on. But I'll try to go through this as quickly as I can. I don't want to belabor everybody, but we're excited to be here. We definitely have a different approach on how we provide medical services, and I guess let me start with this and make it a little bit easier. I'm a little nervous, sorry. Let me make sure I can move this along here. This was the oral presentation we did a few months ago. Some of the people that were on the presentation team, all of these folks are still obviously with the company. Our Chief Medical Officer, Dr. Jimmy Fernandez. Manny Fernandez is our Chief Operating Officer. Tamara Taylor is the Regional Vice President for this area. Myself, and then my boss, Glenn Hamlet. He is based actually in Dallas, has been in the business for a long time as well. Our company was founded in 2004. We're still owned by a physician, as Warden Betti had mentioned earlier. And I think the takeaway from this slide really is as Warden Betti had said, that we have over 150 years of experience, and I think looks like it's actually closer to 200. The company started in Florida, and our bread and butter where we started were in like retirement communities and using the Medicaid and Medicare those services to help provide services for people in Florida, and this grew into correctional space, and we currently are in Franklin County, Ohio. That ADP is about 2,200, I would say. It's a very beautiful facility. It's probably the nicest correctional facility in North America. We're also in Erie County. We just celebrated our 1-year anniversary on December 15th in Erie County, and we've done a fantastic job there. We're very proud of that. We had a fantastic state audit back in July. The auditor was like, "Who is Armor? Who are these people?" They were very, very, very excited about our processes and our programs. I'll get into a little bit about how we provide what we call guardrails to keep all of our staff on track. And it keeps us keeps someone from skipping a step, and that's really what it comes down to. So our foundation, behavioral health, obviously the clinical interventions, and then obviously medical, behavioral, and then our data, the way that we use data is incredible. And again, all that data has to be actionable. And that is one of the things that what really sets us apart is the way that we staff, we retain, and that the way that we use our data to make things better and make people's lives better. The patients, the staff, and then obviously when you have happy staff and happy patients, you obviously have a happy administration as well. So. Risk stratification. I don't want to go into a lot of this, but we're actually using the Charleston Core Mobility Index. And so this is all based on evidence-based algorithms to make sure that we're covering all the bases. The biggest point for us is assessment. When an inmate comes in the building, it's getting an aggressive assessment and making sure that they're on an aggressive plan moving forward. So we know to move, let's say, number 99 and move them up to the front of the line and not put them on a plan where they're being seen every 30 days, but they're maybe being seen every 3 days. So that initial assessment is, we think, is the most important part of what we do. We do a very aggressive intake assessment. And if you look at this, you'll see that when we provide risk scores, if you have a low risk score, you can see the average cost, and you're looking at 5,200 patients that fall into that category. But if you look at anyone that has a higher risk score of, say, 5 to 18, those folks are the ones that are going to be admitted to the hospital more. They're going to be using up the cost of trying to provide for those folks in that risk score. So we identify it early, and we really think that that's a success that we have putting people on an aggressive plan going forward to make sure that we're providing the same level of care that you would expect on the outside of the walls. These are some of the things that we're proud of that we've moved from 2019. Really, 2019, Armor really turned the company around with new leadership and new management. And we really feel like we made some really big inroads. And you can see from the numbers, the hospital admission, the length of stay, and the actual admission rate. And I know that this is a big issue for most facilities in America. Obviously staffing is an issue on both medical and on correctional. And we know that every time that someone goes out of the building, you're looking at least 2 correctional officers to provide that transport, and it takes away from having people in the building. So we're really proud that if we send 10 people out to the hospital, 6 or 7 of those folks will be actually admitted to the hospital. So they're not going out and then coming right back. Some of the things that we ask that our medical providers do is that they can actually do sutures. So if someone needs a stitch or a couple of stitches here and there, they don't have to automatically be sent out to the hospital to do that. So that's something that we pride ourselves on as well. Catastrophic cases, again, by identifying high-risk people at the beginning, at day one, we're able to lower our risk all the way across. And you can see from 2017 to 2023, the reduction in numbers. And obviously, you can see that we, even in up to 2023, we have no really high catastrophic cases. On-site specialty, obviously, we try to get as many on-site visits as humanly possible to coordinate with the local community. We try to work with all the community providers in the area as much as humanly possible. And that's just something that we do, again, to try to keep from having to transport patients off-site. Founded grievances, that's something we're very proud of. This is sort of like what we would call like if you went to your doctor and then when you got back and you had to fill out a form saying, how was your visit? You know, how do you feel like you're cared for? We feel like this has a big, it's a big plus for us all the way around. That these are, when I say founded, that, you know, they're actually investigated down to make sure that they're actually founded grievances. So skip over to our data analytics. Like I said, we use the technology and we build these dashboards. So Warden Betti can come in, sign in, and take a look at whatever he is most interested in looking at on that particular day or at that particular time. So this will give you, your H&Ps are the physicals that are done within 10 to 14 days is our requirement. So you can look at H&Ps, sick calls. We also keep track of what goes on the weekend versus the weekday, because we know that sometimes providers are not available on the weekends. So this is just kind of a typical example of the dashboards that we can customize. And this one, I think, is one of the best. You can look at intakes, you can look at health assessments, sick calls, where you're at with behavioral health. So everything you have is at a glance. And when you click on these, I don't have this set up on Wi-Fi, but when you click on these, you can drill down to the actual patient level. So in other words, if someone calls and says that we don't think that John Doe is getting the treatment, anyone in admin that has access to this can go in and drill down on that real time. So you can drill down and go, they were seen 11 times in the last 30 days, and they were seen at 8:37 this morning. So it's really valuable information to have at your fingertips. You're not waiting for a report to be generated. So you can just go in and drill down on any of these. Like if there's dental, sick calls. So we really pride ourselves on how we do that. I know that Erie started up a year ago, and then within a month, Andrew went up and saw Warden Holman and his admin, and then built these dashboards directly for them. So if Colleen is looking to, at specifically like pharmacy or off-site, you can just go in and automatically take a look and get real-time data on what's happening, not having to wait for 10 days or 2 weeks to get a report generated. So let's see what else we have. And these, again, these are just some of the breakdowns of data. And normally you could click on, if you want to click on gastro, you can pull down and you can see what patients are in that category. If it has to do with cardio or hypertension, you can drill down on that. So unfortunately, I can't drill down on this presentation, but it gives you a good idea of what we do. And then staffing, again, the data, how we use data, and then staffing. We really know how important staffing is. We go out of our way to really train and support and invest in our medical staff. I've said that before about investing in medical staff. It's the training, it's giving them the confidence that they need, it's supporting them in every way. So we use ERI, which is Economic Research Institute, and what that does is it breaks down to zip code, every pay for a RN, and that also goes as far as 1 to 2 years, 2 to 5 years, 5 years plus. It gives us a real solid idea of exactly what they're making in the hospitals down the street. We know that we have to be at the upper percentile to retain the staff that we need to get the job done. So that's something that we work with. We have sign-on bonuses. We have retention bonuses. Student loan reimbursement. One of the things we were trying to do, think outside the box, is giving people the opportunity to basically hand over their student debt. And we use Fidelity. I think most people are familiar with Fidelity. And this will pay, I want to say somewhere between $175 to $250 a month every month that they stay with Armor. So, and that'll pay off up into about $20,000 worth of student debt. So that's a big plus for us. We have a 98% retention rate for anyone that joins the student loan reimbursement program. And then Advanced Health Solutions is a in-house staffing agency that we started during COVID because agency nursing was crazy. So we decided to have our own in-house staffing, and it's made a huge help for us. And then white glove experience. We know that when they have a good onboarding experience, 69% of the people stay on for 3 years. So that's really important to us, and that's why we've been chomping at the bit to get in here. We want to make sure that the staff are comfortable, they have a level of comfort with us, and know that they're going to be supported. And we don't want people leaving because they don't know about Armor or they're a new employer. So, but we go out of our way to really take care of our people. We have people that do nothing but just call staff and say, how did your day go? What can we help you with? How can we support you? Do you need any training? So all of those things come into place for bringing people on board and keeping people. So that's the most important thing for us. And I guess that's the end of my slide. So I will open it up to questions.
So this is the presentation that you made to the committee that was reviewing all of the proposals?
Yes.
Okay, all right. Anybody have any questions for Mr. Caldwell?
I have one. How many full-time employees will you have on staff in the prison?
Total 27.7 FTEs, full-time equivalent. So 25 will be day-to-day, and then 2.7 FTEs will be for the MAT program. So it'll be a total of 27.7.
And Warden, do you just want to talk about your experience in talking with the Warden of Erie? Because I know that they work with Erie counties, and we've talked about the positive things that they had to say. So you just want to talk about that?
Yeah, I had a lengthy discussion with Warden Mike Holman because they were the only other county at this point in time that had Armor Health, and he had nothing but glowing and raving reports for Armor Health. He really appreciated, and Rex hit on this at the beginning of his presentation, he really appreciated the emphasis that they put on those medical runs, ER visits, appropriate ER visits. He said he saw a huge difference. At the time I spoke with him, it was probably August, maybe September. So they had been with them for 8-9 months, and Mike had seen the difference already and had nothing but good things to say. He said that they, any issues that they had, it was as easy as pick up the phone and give a phone call, and they got a very good response from Armor Health. They were very responsive to his needs as well. So I appreciate that again, and I'm pretty sure everybody on the board knows that a lot of our overtime throughout the course of this year is attributable to ER visits and medical runs. Because as Rex said, when you go to the ER, you're talking probably 4 to 6 hours, and that's for somebody coming right back. Because if they're there for something that's not life-threatening, I won't give an example, but if they're there for something that could have, maybe should have been handled at the prison itself, we now have to pull 2 officers to take that individual to ER and backfill. That means overtime. So,
Okay, thank you.
yep, thank you.
Warden, a very high percentage from the past provider, right?
Yes,
That admitted them there, were sent right back to the prison, right? They were never admitted.
correct.
They were looked at.
Yeah.
I'm sure that's going to save a lot of overtime in itself.
Yeah, yeah. And again, that's what Warden Holman was saying out in Erie County. And that was a big selling point to me when Rex and the team had mentioned their emphasis. The fact that they're doing analytics on the ER visits was impressive. I'm kind of a math nerd, if people didn't know that. I'm a math nerd, so that got me.
And you were part of the committee that interviewed not only Armor, but the other proposals,
Yes,
right?
yes.
And how many more were there? 3 others?
3 others.
Okay. All right. And this is
It may
your...
have been 4. 4? 4.
There were 4? Okay.
I'm
And
sorry.
This is the committee's recommendation is Armor.
Yes.
Okay.
And Warden, out of all the proposals, obviously, high-quality healthcare is the most important thing. But in terms of cost, this proposal they were the lowest out of all of them, correct?
That was the icing on the cake. Yes, they were the lowest.
Okay. Thank you.
Yep.
Okay.
One of the things I did want to mention is that I mentioned guardrails. That is something, using the data that we have, it just, again, it keeps our staff from missing a step. And that's really what it comes down to. We don't, if it's A through D, you can't skip B and C. You have to do B and C before you can do D. And that's something that's very important for us, and it keeps everybody on track. The other thing that we use our data for is if someone has an allergy and the nurse clicks that box, it automatically will order an EpiPen with that patient's name on that particular EpiPen. When we have an encounter, when a medical provider or a nurse has an encounter with a patient, it will automatically schedule the next meeting. And so it might be, instead of, again, 7 or 8 days, it could be in 3 days. So there's a lot of things that are built in to our data and our technology that just makes everyone's life a little bit easier. I don't want to say easier, but yeah, I guess that's the best way to put it. But just to make sure that it feels like they have like a nurse looking over their shoulder to kind of help them, give them a second opinion to make sure that they're moving in the right direction. And again, we call it guardrails, and I think that it's a good way to look at it, and it keeps everybody on track. And we've had really, really good outcomes. And I really like the fact that it's got the automatic ordering of medications, and our new EHR, our electronic health record system works directly with Diamond Pharmacy. Now, fortunately, you guys have Diamond, and we're going to continue with Diamond, and that's going to be a big help for us as well. And so we're just ready to get in and make sure that we can do meet and greets and give, like I said, the staff the comfort level that they need. And then we have a lot of code to write to transfer the EMR or EHR over to Sapphire. So that's why we've been kind of chomping at the bit to try to get started as soon as possible. So I appreciate being here. If you have any other questions, feel free to ask.
Okay, I'll ask you to stand by because we have a public comment section, public questions, and some of the public who are here may have some questions for you. So it'd be good if you can stay. Anybody else from the board have any questions for Mr. Caldwell?
I think you said you'd be working with existing staff now, Rex, or would you be hiring new people?
Both. We're going to try to retain as many people that we can right now, and then we have a process started to already start recruiting to get more people to make sure that we can cover the full 27.7 FTEs.
Okay.
Okay, anybody else? So, as you know, the board doesn't enter into an agreement. It's our function to make a recommendation to the Board of the Commissioners, who will enter into an agreement on behalf of the county. So on our agenda is a motion to recommend to the Board of Commissioners that Armor Health be awarded the contract for provision of medical services at the Lackawanna County Prison. So, is there someone to make that motion? Do I hear that motion?
I'll make that motion.
Do I have a second?
Second.
On the question? All in favor?
Aye.
Okay, the motion is approved, so we are recommending to the Board of Commissioners that Armor Health be awarded the contract for medical services at the Lackawanna County Prison. Anybody from the public wish to address the board? Bev?
Bev DeBarros from Scranton. I appreciate your presentation. Thank you.
Thank you.
And what do you have for dental care?
I'm sure we'll keep the current dentist. We have dental, mental. I'm not sure exactly what you're asking about.
When you see the people there, there are a lot of needs for dental care. And I'm thinking somebody that's in there for more than a short time, if those needs could be addressed, if they could leave the prison healthier than when they came in with, like that.
Well, that's absolutely our goal from on medical, mental health, behavioral health, and dental, obviously. I've heard good things about the current dentist, but we can qualify and quantify that as we go in and start interviewing and start doing meet and greets.
Good, thank you for that.
No problem.
We talk about these huge numbers, many thousands of dollars invested and a lot. But the canteen fund, as you know, is made up from excess proceeds from the commissary account and the tablet account. The prices are really high and burdensome. This isn't for you. Yeah. And for instance, I brought something in the dollar store. You can get, this is a pack of ramen noodles. In the dollar store, there's 5 in a pack for $1.25. In the jail, they're 88 cents for a 25-cent pack. and on. Toothbrushes, they have to buy $2.95. So I was just given lists of expenses that are really hard to meet. But I really wanted to talk about something else. I'm glad that Classroom B is open and functional. Maggie's class is wonderful. And I would also like to suggest that we begin a sewing class in there and begin it soon. Boscov's has, for less than $100, a new portable sewing machine. If we got, I'm thinking minimum 5 or maximum 10. But hiring a teacher, I know Marywood teaches like that, sewing for their programs. When a person came out with that skill, and it wouldn't take long, they could, instead of having to apply for jobs, which, as you know, problems, because as soon as you check that box about you've been incarcerated.
That just means you're 3 minutes. That's your 3 minutes, Bev. But so you have an interest in starting a sewing class.
Yeah.
Okay.
So
With
I
needles.
speak from personal experience. My business is in my house with a little sewing machine, and I make really good money because people have that need. This way, if the people came out of jail with the skill, and also at the end of their class, those who are thinking of having a business of their own, the University of Scranton has a small business administration that would come and teach them how to set up a business. And then you just go to City Hall and get a license, and you're on your way. Just for a small investment could have a really, really good impact.
Okay.
But the commissary funds need to be looked at, and the charges for the tablets.
Okay. Thank you. Anybody else? Eileen?
Eileen Acapinti, Dunmore. Welcome, Mr. Caldwell. I'm a nurse I'm retired now, but my concern is the continuity of care when people first come into the prison and then when they're being discharged. So you did mention that you coordinate with community providers. Can you be more specific as to the providers that you will be working with?
List off the top of my head, I know that we had worked, we had reached out to the Wright Center previously.
Okay.
And I know that Denise and some of our people at corporate have been working with the local community as far as partners on that. So we're very, like I said, that's what we do. We want to reach out to as many local people as we can and make sure that we provide whatever services we can. And we even have dashboards that show recidivism to make sure that we're placing them in the right part of the county to get the care that they need. So if they live in this part of the county, we want to make sure that we're targeting that area to provide the services that they need going forward.
Do you do what I would call a discharge plan?
Yes, absolutely.
Okay, so how about like Scranton Counseling Center? They do provide a lot. So would those people be invited into the prison prior to the release of that person, or not necessarily?
I mean, I'm not sure how that would work as far as coming into the prison, but I mean, I know that we want to make sure that they're making contact. I'm sure there's an area that within the prison that they can meet and actually develop some type of relationship with.
Right. Because if you're 27.7 full-time, how many are mental health delegates or professionals?
That's a tough one off the top of my head. I don't have the staffing plan in front of me. I'm going to say in the neighborhood of 4.
Okay, and they're full-time. And on that initial assessment, when people come to the prison, a mental health evaluation is part of that, I assume?
Absolutely, absolutely. And if they come in, our policy is if they come in on their 3rd visit, they automatically are referred to mental health, period. It just regardless.
Okay, thank you, and good luck.
Thank you so much.
Thank you, Eileen. Anybody else from the public? Okay. Any other business from members? Okay. If not, I'll entertain a motion to adjourn. Nobody
Second.
wants to adjourn? Oh, okay.
Second.
All right. On the question, all in favor?
Aye.
Aye.
Any opposed? The ayes have it. We'll adjourn for the year. We'll see you in 2025. Happy Christmas to all, and happy Hanukkah as well. Mark, we're hanging up. Thanks.
Thank you all. Happy holidays. Thank you.
Thanks, Mark. Good job, Judge.